Hello and welcome to the very first video on the Reading Reddit YouTube channel. Today we will be going over one of the most infamous Reddit posts in arguably the history of the website. This particular story is called The Swamps of Dagobah. If you have ever heard of this story, then you know how gross and disgusting it is. If you have not, buckle in because it is gross and disgusting. I will be reading the entire post. So strap in. If you are sensitive or get easily nauseated, I would recommend skipping this particular video. However, if you're curious to know a piece of Reddit history, stay tuned because I'll read the entire post. Here we go. The story of the Swamps of Dagobah, originating from an Ask Reddit thread titled Doctors, Nurses, Redditors, what has been your most gory, disgusting, or worst medical experience? This was originally made by user Bonsai Panda 10 years ago. OR nurse here. This is kind of a long one. I was taking call one night and woke up at 2 in the morning for a general surgery call. Pretty vague. But at the time, I lived in a town that had a large population of young military guys and avid meth users, so late night emergencies were common. Got to the hospital where a few more details awaited me. Pararectal abscess. For the uninitiated, this means that somewhere in the immediate vicinity of the butthole, there was a pocket of pus that needed draining. Needless to say, our entire crew was less than thrilled. I went down to the emergency room to transport the patient. And the only thing the ER nurse said was, as she handed me the chart, was, "Have fun with this one." Amongst the healthcare professionals, vague statements like that are a bad sign. My patient was a 314-pound Native American woman who barely fit on the stretcher I was transporting her on. She was rolling frantically from side to side and moaning in pain, pulling at her clothes and muttering Hail Marys. I could barely get her name out of her after a few minutes of questioning, so after I confirmed her identity and asked what we were working on, I figured it was best just to get her to the anesthesiologist so we could knock her out and get this circus started. She continued her theatrics the entire 10-minute ride to the OR, nearly falling off the surgical table as we were trying to put her under anesthetic. We see patients like this a lot, though, chronic drug abusers who don't handle pain well and who have used so many drugs that even an increased level of pain medications don't simply touch simply because of high tolerance levels. It should be noted, tonight's surgical team was not exactly wet behind the ears. I had been working in healthcare for several years already, mostly psych and medical settings. I've watched an 88-year-old man tear out a 1-inch diameter catheter balloon out of his penis while screaming, "You'll never make me talk." I've been attacked by an HIV-positive neo-German political party from World War II. I've seen some shit. The other nurses have been in the OR as trauma specialists for over 10 years. The anesthesiologist had done residency at a level 1 trauma center, or as we call them, knife and gun clubs. The surgeon was ex-army and averaged about 8 words and 2 facial expressions a week. None of us expected what was about to happen next. We got the lady off to sleep, put her onto the stirrups, and I begun washing off the rectal area. It was red and inflamed. A bit of pus was seeping through, but it was all pretty standard. Her chart had noted that she had been injecting IV drugs through her perineum, so this was obviously an infection from dirty needles or bad drugs. But overall, it didn't seem to warrant her repeated cries of, "Oh Jesus, kill me now." The surgeon set up with the scalpel, sticks the tip in, and at the exact same moment, the patient had a muscle twitch in her diaphragm. And just like that, all hell broke loose. Unbeknownst to us, the infection had already tunneled nearly a foot into her abdomen, creating a vast cavern full of pus, rotten tissue, and fecal matter that had seeped outside of her colon. This godforsaken mixture came rocketing out of that little incision, like we were recreating the funeral scene from Jane Austen's Mafia. We all wear waterproof gowns, face masks, gloves, hats, the works, all of which were as helpful as rain boots against a fire hose. The bed was in the middle of the room, an easy 7 feet from the nearest wall, but by the time we were done, I was still finding bits of rotten flesh pasted against the back wall. As the surgeon continued to advance his blade, the torrent just continued. The patient kept seizing against the ventilator, not uncommon in surgery, but with every muscle contraction, she shot more of this brackish, gray-brown fluid out onto the floor until, within minutes, it was seeping onto the nurse's shoes. I was nearly 12 feet away, jaw dropped open within my surgical mask, watching the second nurse dry heaving and the surgeon standing on tiptoes to keep this stuff from soaking his socks any further. The smell hit them first. "Oh God, I just threw up in my mask." The other nurse was out. She tore off her mask and sprinted out of the room, shoulders heaving. Then it hit me, mouth still wide open, not able to believe the volume of fluid this woman's body contained. It was like getting a great big bite of the despair and apathy that permeated this woman's life. I couldn't friggin' breathe. My lungs simply refused to pull any of that stuff in. The anesthesiology went down next. An ex-NCAA D1 tailback, his 6'2" frame shaking as he threw open the door to the OR suite in an attempt to get more air in, letting me glimpse the second nurse still throwing up in the sinks outside the door. Another geyser of pus splashed across the front of the surgeon. The YouTube clip of David and the dentist keeps playing in my head. Is this real life? In all the operating rooms, everywhere around the world, regardless of socialized or privileged, secular or religious, big or small, there is one thing that is the same. Somewhere, there is a bottle of peppermint concentrate. Everyone in the department knows where it is. Everyone knows what it's for. And everyone prays to their gods they never have to use it. In times like these, we rub it on the inside of our masks to keep the outside smells at bay long enough to finish the procedure and shower off. I sprinted to our central supply, ripping open the drawer where this vial of ambrosia was kept, and was greeted by an empty frickin' box. The bottle had been emptied and not replaced. Somewhere out there was a godless bastard who had used the last of the peppermint oil and had not replaced a single friggin' drop of it. To this day, if I figure out who it is, I'll kill them with my bare hands, but not before cramming their head up the colon of every last meth user I could find, just so we're even. I darted back into the room with the next best thing I could find, a vial of mastisol, which is an adhesive rub we use sometimes for bandaging. Not as good as peppermint, but consider that over 1/3 of the floor was now thoroughly coated in what could easily be mistaken for a combine of bovine afterbirth and maple syrup. We were out of options. I started rubbing as much of the mastodol as I could get on the inside of my mask, just glad to be smelling anything except whatever slimy demon spawn we had just cut out of this woman. The anesthesiologist grabbed the vial next, dousing the front of his mask so he could stand next to his machines long enough to make sure this woman did not die on the table. It wasn't until later that we realized that mastazole can give you a mild high from huffing it like this. But in retrospect, that's probably what got us through. By this time, the smell had permeated out of our OR suite and down the 40-foot hallway to the front desk where the other nurses still sat, eyes bloodshot and watery, clenching her stomach desperately. Our suite looked like the underground river of ooze from Ghostbusters 2, except dirty. Oh, so dirty. I stepped back into the OR suite, not wanting to leave the surgeon by himself in case he genuinely needed help. It was like one of those overly artistic representations of a zombie apocalypse you see on fan forums. Here's this one guy in a blue surgical garb, standing nearly ankle deep in lumps of dead tissue, fecal matter, several liters of syrupy infection. He was performing surgery in the swamps of Dagobah, except the swamps had just come out of this woman's butt and there was no Yoda. He and I did not say a word for the next 10 minutes as he scraped the inside of the abscess until all the dead tissue was out. In front and the front of his own gown, a gruesome mixture of brown and red. His eyes squinted against the stinging vapors originating directly in front of him. I finished my required paperwork as quickly as I could, helped him stuff the recently vacated opening full of gauze, taped this woman's buttocks closed to hold the dressing for as long as possible, woke her up, and immediately shipped her off to the recovery ward. Until then, I'd only heard of alcohol showers. Turns out, 70% isopropyl alcohol is about the only thing that can even touch a scent like this once it's soaked into your skin. It takes 4 or 5 bottles to get really clean, but it's worth it. It's probably the only scenario I can honestly endorse drinking a little bit too. As we left the locker room, the surgeon and I looked at each other, and he said the only negative sentence I had heard him utter in 2.5 years of working together. That was bad. The next morning, the entire department, a fairly huge floor within the hospital, still smelled. The housekeepers told me later that it took them nearly an hour to suction up all the fluid and debris left behind. The OR suite itself was closed off in quarantine for 2 more days just to let the smell clear out. I laugh now when I hear new recruits to healthcare talk about the worst thing they've seen. You ain't seen poop, kid. TLDR, don't shoot IV drugs into your taint. Wow, a piece of Reddit history, and deservedly so. The first time I had ever read this particular story, I started regretting my decision to go into the healthcare field, to be honest. However, these types of scenarios are few and far between. Plus, I do not work in the OR or the emergency department, so for me, I see these types of things even less. The worst I see is a bed sore or 2 working in long-term care. This was truly a wild ride. Let me know if you guys enjoyed this video. Don't forget to like, comment, and subscribe, and I'll see you in the next post.